I pledge to focus on a culture that advances and supports patient safety.
I pledge to create a patient safety awareness section in our pediatric newsletter.
I pledge to make you as comfortable as possible after your surgery.
I pledge to communicate with everyone that comes through the front door with patience and compassion.
I pledge, as a respiratory therapist, to maintain all of our equipment and manage ventilation on an individual, patient-centered basis.
I pledge to be a patient safety advocate multi-site across Hamilton Health Sciences.
I pledge to actively participate in my unit's nursing practice council to improve patient safety within the OR.
I pledge to make sure the carts are in working condition before I use them.
I pledge to ensure that our equipment is cleaned prior to and after each use.
I pledge to let people know the code of the month.
I pledge to keep my patients safe.
I pledge to always have compassion and take patient safety first.
I pledge to promote patient safety across pediatrics.
I pledge to obtain informed consent from parents and assure that that consent is available before I perform procedures on sick newborns.
I pledge to wear my name tag so patients know who I am and what I do.
I pledge to wash my hands.
I pledge to document all interactions with my patients as accurately as possible.
I pledge to help visitors with directions if they seem lost.
I pledge to practice safe hand hygiene.
I pledge to make a safer environment by being open and available to family concerns.
I pledge to advocate for my babies and their families by attending rounds and ensuring that a comprehensive plan of care is developed, documented, and then carried out.
I pledge to always and continue to put patient safety first.
I pledge to advocate the safety checklist in the OR on a daily basis.
I pledge to follow up on all concerns expressed by the families and the patients in our children's hospital and ensure that there's something that's solved.
I pledge to make sure when I bring my patient in the room that I have the right patient's name and birth date.
I pledge to be the most approachable I can be with my colleagues.
I pledge to ensure that our most critically ill patients are ultrasounded in a timely fashion.
I pledge to direct as many staff, families, and visitors to our hand hygiene stations as possible.
I pledge to engage frontline staff in communicating safety to parents and families.
We pledge to check our equipment every day.
I pledge to put the brakes on the stretchers before we get the patients off.
I pledge to promote medication safety.
I pledge to make sure every test is accurate.
I pledge to question any resident or doctor if I believe their course of treatment is not in the best interest of my patient.
I pledge to always be polite. I pledge that our staff is educated in safety.
I pledge to ensure a clean, safe, comfortable environment.
I pledge to enhance medication safety by ensuring everything is checked from the prescription to the administration to the patient.
I pledge to always do transfer of accountability at the bedside.
I pledge to always make sure I have 2 identifiers on my patients: date of birth, identification, or check their ID band.
I pledge to foster open lines of communication between patients, families, and staff.
I pledge to work as a team for patient safety.
I pledge to have the courage to speak up whenever I see someone breach infection control technique.
I pledge to always put up the door on the neonatal isolate when I finish my examination.
I pledge to always document accurately and concisely.
I pledge to monitor safety conditions in the McMaster Children's Emergency.
I pledge to file an SOR for any actual events or safety occurrence near misses to prevent such events in the future.
I pledge to make food safety priority 1.
I pledge to elevate the bed rails.
I pledge, as a charge nurse, to guide all new staff members in the NICU to ensure that our babies are cared for safely and effectively.
I pledge to complete chart check at the end of every shift.
I pledge that I would like to see our hand hygiene measures still increased to enhance the patient safety regarding nosocomial infections and late onset infections on our unit. I would like to see us come down to 0.
I pledge to support the educational needs of staff in the OR to help improve patient care here at McMaster.
I pledge to always make sure my patients have their armband on.
I pledge to keep the children as safe as possible, and if it means I've got to put a wet floor sign before I wash the floors, and things like that are very important so no one hurts themselves.
I pledge to assess my patient for falls.
I pledge to wash my hands after and before each patient.
I pledge to communicate effectively with all team members.
I pledge to relay all patient information to my preceptor.
I pledge to greet every patient with a smile. Although it's a small gesture, it works well to make people feel comfortable.
I pledge to make sure medications are double checked at the bedside for patient safety.
We pledge to keep our playroom safe.
I pledge to make sure that all of our families are sent home with the appropriate equipment and have the proper training before discharge.
I pledge to continue to follow up on all safety issues that arise, whether it's through an SOR or just stopping me in the hallway and telling me about something that's happened. I pledge to continue to follow up on all of those.
I pledge to wash my hands between every patient.
I pledge to keep my clinic room safe and childproof.
I pledge to practice good hand washing routines.
I pledge to work with everybody in surgery to make sure we communicate clearly for patient safety.
I pledge to educate families on the increased risks of a fall while their child's in a hospital environment and what they can do to prevent these and make sure their children are safe while they're here.
I pledge to take part in implementing new pediatric falls prevention initiatives at McMaster Children's Hospital.
I pledge to ensure that I have the appropriate size of respiratory equipment for the child that I'm caring for.
We pledge to provide nourishment that is safe and appropriate for all patients.
I pledge to monitor visitors to PICU.
We pledge to promote and encourage excellent communication
between all members of the pediatric medical health team.
I pledge to ensure that I always double-check patient labels when preparing each baby's milk.
I pledge to drive slower in the parking garage.
I pledge to keep all those that come in and out of this hospital safely throughout the night and to respond to codes accordingly.
I pledge to always complete a systematic assessment for every patient.
I pledge to always keep the toys clean.
I pledge to always raise the side rails so the babies don't roll out of their cribs.
I pledge to teach mums and dads about the benefits of breastfeeding, because the many benefits of breastfeeding improves baby's health, mom's health, and increases the bond between mom and baby. All of these benefits improve the health and safety for their family.
I pledge to follow all hospital-wide policies and procedures.
I pledge to always make sure our equipment is safe and well maintained.
I pledge to ensure all safety and emergency equipment is in working order at the bedside.
I pledge to provide patients and families with education and resources in order to help them make informed decisions in their health care.
I pledge to always have the arrest carts fully stocked and ready to go.
I pledge to do the 8 rates before giving any medication.
I pledge to ensure all families are made aware of the PACE team on admission to hospital.
I pledge to provide all medication properly to each patient within the hospital to help provide best care.
I pledge to always check with the nurses before meeting my students for school.
I pledge to always double check my work to avoid medication errors.
I pledge to effective patient handover.
I pledge to log into my Voicera.
We pledge to teach. Are you going to read?
No,
don't. All right. We pledge to teach patients and families how to ensure safety through the use of bed and crib rails.
Yay! I pledge to make sure all the toys are safe for the children.
We pledge to make sure patients get to where they need to be safely.
I pledge to ensure that the families that I'm involved with, as they prepare to go home with medical technology and equipment, that they receive the education and that they feel comfortable with all of the equipment needed to make their child feel safe at home.
We pledge to always put patient safety first.
I pledge to always check patient demographics when registering to make sure all information is up to date and accurate.
I pledge to clean all assessment tools.
I pledge to continue careful hand washing.
I pledge to always double-check med dosages before giving them to my patient.
I pledge to always use the brakes on wheelchairs with students in the schoolroom.
I pledge to continue to listen to parents and validate all of their concerns because they know their children better than anyone.
I pledge to work with staff to create the safest ambulatory clinic environment for patients, families, and staff.
I pledge to always wear my protective gear when handling cytotoxic drugs.
I pledge to respond to all codes quickly.
I pledge to have the children wash their hands before and after using my food models.
I pledge to ensure that faulty equipment is sent for repair.
I pledge to continue to be an advocate of all three phases of the surgical safety checklist in the operating room.
I pledge to always double-check high-risk medications with another nurse.
I pledge to properly shield my patient before I x-ray them.
I pledge to encourage staff to report occurrences and near misses.
We pledge to ensure that all babies get offered
newborn screening at McMaster Children's Hospital.
I pledge to keep the babies safe and support their heads when I'm holding and cuddling them.
I pledge to transcribe orders carefully to ensure our patient safety.
I pledge to keep patients' confidentiality.
I pledge to always have the right drug for the right patient.
I pledge to make McMaster Children's Hospital the leader in radiation safety for children.
I pledge to assist all new RNs in becoming proficient in their clinical skills.
I pledge to always use guardrails on the Alaris pumps.
I pledge to collaborate with allied health professionals to improve patient safety.
I pledge to active listening to improve communication.
I pledge to provide timely data to our clinicians to measure the success of our safety initiatives.
I pledge that all chemotherapy orders are properly written and counter-checked using chemotherapy passports.
I pledge that safety equipment is set up and ready to go before any admission.
I pledge to always check armbands.
I pledge to always double-check high-risk medications. We pledge to inform our staff and senior residents of patient and family concerns.
I pledge to always put patient care first.
I agree with you.
I pledge to continue and be an excellent communicator with my families and patients.
I pledge to pay close attention to details and clean the equipment thoroughly.
I pledge to ensure that my patient's weight is correct before they go to the operating room.
I pledge to always wash my hands before and after patient contact.
I pledge to clean the equipment after every exam.
I pledge to keep patient confidentiality.
I pledge to support all my colleagues every day in all our services.
I pledge to work continuously with my fellow co-workers for patient care.
I pledge to always get your samples out of here on time and quickly so that your doctors get your results fast.
I pledge to make sure my patients understand my instructions before going home.
We pledge to lead and inspire a culture of engagement, commitment, and action to become Canada's safest children's hospital.
I pledge to continue having fun at work.